minutes.
Thank you very much. First, I want to compliment each one of you. You gave excellent testimony, and what I like best about each testimony is that anyone that's tuned into this hearing across the country could understand exactly what you do. And so this is, you've just done a terrific job. You know, we both the acting chairman and myself have made mention of 80 years, the CDC. But I think that we need to appreciate what's happened over 80 years. I mean, the population of the United States 80 years ago, 1944, we had 138,400,000 population in the United States. Today, we're a population of 333.3 million people in our country. So that's almost a triple the population. And with that tripling of a population and really being a global society today, I mean, 1944, most people really didn't travel anywhere. Now the whole world is crisscrossing the globe on a consistent basis, so the challenges have changed enormously. Dr. Arwady, in the current funding bill, your center's funding is eliminated. That's pretty chilling after your testimony of what you do. I especially appreciate your saying, and I did not know this, that overdose rates fell in 2023 for the first time in 5 years. So how is this, what's going to happen with the elimination of your center?
It would be devastating for the work to prevent injuries and violence, including overdose and suicide, if this funding did not exist across the country.
Is there any other place in the federal government under HHS where this is tended to?
So we work across the federal government. A problem this big, like opioids, for example, requires multiple agencies. Our work at CDC is complementary. It is not duplicative. But at CDC, for example, it is our data systems that actually let us know what Americans are overdosing from today. It's the systems that let us have the real-time data. It's the systems that let us know how that threat continues to evolve. And importantly, it's the work that funds the frontline public health response to this threat.
I hope that on a quiet basis that my colleagues on the other side of the aisle will talk to some of their colleagues in their caucus about what they have recommended in their appropriation bill, because I think that this is devastating. This is an issue that on both sides of the aisle, members have been deeply, deeply concerned about and have experienced in their congressional districts, the number of deaths from overdoses. Now, in public health, and it's the case, I think, especially with AI now, good data is gold. And good data helps to predict viral outbreaks, detect emerging trends in illicit drug use, track diseases and wastewater. So to Dr. Layden, does the CDC have access to the health data it needs? And if not, what prevents the CDC from getting that data? How do we fix it? And another question, how do you respond to those who are concerned? I think all of us are always concerned about how that data is used properly. There are some, one of the concerns that's been raised by some members is how the CDC uses its data, and does it track people in their daily lives?
Thanks for that important question. So a few things. One, CDC in public health has been underinvested for decades. This has led to delays and gaps in the data that we need for national situational awareness and early threat detection. We've seen the benefit and the impact thanks to data modernization and COVID-related funds over the last 4 years. Tremendous progress in a very short amount of time, but there's more work to be done. We need continue and increased funding to ensure that not just CDC, but public health broadly can modernize the systems. The systems at the state, local level are the ones that collect the data, act in the front line, and then send the data to CDC. We need
So
to,
it goes from the local to
in the
you,
vast majority of
not
instances, yes.
the other way around.
Yeah. So that continued sustained funding with so much of our funds going out to the jurisdictions needed to ensure that we have these robust capabilities. We also need data authorities. We do rely on voluntary reporting that leads to a patchwork of the data that does come to CDC. So when we want and need national situational awareness and early threat detection, having that secure ability to receive that data so that we can act and support the nation and our communities is critical.
Well, thank you again to each one of you. I'm going to submit written questions to you, and I think that each of you has done a terrific job today. I yield back, Mr. Chairman. Thank you for your patience.